You're 12 weeks pregnant and standing in your gym, staring at the treadmill you've used for years. Your heart rate is already elevated, not from exercise, but from worry. Can you still run? Should you lift those weights? What if you do something wrong? You want to stay strong and healthy, but the internet is full of conflicting advice and horror stories that make you wonder if the safest choice is just to do nothing at all. If this channel helps you feel more confident and informed during your pregnancy, subscribe so you never miss guidance that matters. This confusion is completely normal. Pregnancy transforms your body week by week, and what felt safe last month might need adjustment now. You're not overthinking this. You're being thoughtful about protecting your baby while caring for yourself. Today, you'll get trimester by trimester exercise guidance that removes the guesswork. You'll learn which exercises are ideal as your body changes, how to modify your favorite activities safely, what warning signs require you to stop immediately, and how staying active actually benefits both you and your baby. This is about confident, adaptive fitness throughout pregnancy, knowing exactly what your body can handle at each stage and having the knowledge to stay strong, prepare for labor, and protect your growing baby. Let's start with your first trimester, weeks 1 through 13, when your energy is often at its lowest and nausea might peak. Here's what matters most right now. Focus on establishing sustainable habits rather than intensity. Walking, swimming, and prenatal yoga are ideal because they're gentle, adaptable to daily symptoms, and can be modified instantly when you're not feeling your best. If you were already active before pregnancy, you can maintain those activities if they feel comfortable. But honor your fatigue. Your body is building a placenta right now. Your blood volume is expanding by 40 to 50%. That's enormous physical work happening inside you, even if you can't see it yet. The key metric for this trimester is the conversation test. If you can talk comfortably while exercising, you're in the safe zone. If you're gasping for air or can't speak in full sentences, dial it back. This trimester sets your foundation for the months ahead, so consistency matters more than intensity. You're not losing fitness by taking it easier. You're being smart. Your second trimester, weeks 14 through 27, brings your energy back and your belly grows noticeably. Time to modify for stability and comfort. Here's what changes now. After 20 weeks, switch from flat back exercises to inclined positions. When you lie flat on your back, your growing uterus can compress major blood vessels, causing something called supine hypotensive syndrome. You might feel dizzy or lightheaded. Avoid this entirely by propping yourself at an incline. Focus on side-lying leg lifts, wall push-ups, supported squats, and resistance band work that strengthens without straining. This is actually your strength-building window. Your body feels good, your belly isn't massive yet, and you can prepare for carrying increasing weight in the months ahead. Add pelvic tilts and cat-cow stretches to ease back discomfort as your center of gravity shifts. Avoid exercises requiring balance on one leg or quick direction changes. Your ligaments are loosening from relaxin hormone, making joints less stable. Use what's called the 15-degree rule. No movements that bend or twist your body past 15 degrees. This protects your loosening joints and keeps you stable. You're not being cautious for no reason. You're adapting intelligently to real physical changes. Your third trimester, weeks 28 through 40, brings decreased mobility and compromised balance. Prioritize safety and labor preparation now. Walking remains the gold standard. It maintains cardiovascular health, encourages optimal baby positioning, and can be done until delivery day. Many women walk throughout early labor because it feels good and helps progress. Water aerobics eliminates gravity's pressure while allowing full range of motion. The buoyancy supports your belly and takes weight off your joints. It feels incredible when you're carrying all that extra weight on land. Gentle stretching and prenatal yoga help with flexibility and teach breathing techniques you'll use during labor. Those slow, controlled breaths you practice on the mat translate directly to managing contractions. And pelvic floor exercises, done correctly, strengthen the muscles that will stretch during delivery and aid your postpartum recovery. Here's the right technique. Contract your pelvic floor muscles as if you're stopping urine flow. Hold for 5 seconds. Release completely for 5 seconds. Repeat 10 times. Do this 3 times daily. You're training these muscles for the marathon of childbirth and setting yourself up for faster healing afterward. Now let's talk about exercises that directly prepare your body for labor itself. These aren't just workout moves. They're functional training for the most athletic event of your life. Deep squats are incredibly valuable. Hold a squat position for 30 seconds, rest, and repeat 3 to 5 times. This opens your pelvis and strengthens your legs for pushing positions. Many women labor and deliver in squat like positions because gravity helps and it opens the pelvis wider than lying on your back. Butterfly stretches increase hip flexibility for delivery positions. Sit with the soles of your feet together and gently press your knees toward the floor. Pelvic floor relaxation is equally important as strengthening. Practice consciously releasing these muscles because labor requires relaxation, not contraction. You need to learn how to let go. Birthing ball exercises like gentle bouncing and hip circles encourage your baby into optimal position and ease back labor. Cat-cow movements maintain spinal flexibility and help your baby engage properly in your pelvis. When you round and arch your back, you're creating space and encouraging your baby to settle into the best position for birth. Every one of these movements serves a direct purpose for delivery day. You don't have to abandon the activities you love, you can adapt them. If you're a runner, transition to walk-run intervals as your belly grows, then switch to walking. Invest in a supportive belly band that takes pressure off your lower back and pelvis. If you cycle, switch to a stationary bike by your second trimester to eliminate fall risk. You don't need the danger of losing balance or hitting a pothole. For weight training, reduce your weight by 25 to 50% from your pre-pregnancy amounts. Increase your repetitions instead. Focus on controlled movements and avoid the Valsalva maneuver, which means don't hold your breath while straining. This spikes your blood pressure unnecessarily. Swimming can continue throughout your entire pregnancy. Just avoid diving or jumping in. Team sports can work until contact risk or quick movements feel uncomfortable. Trust your body on timing. The principle here is consistent. Modify for stability. Reduce impact. Eliminate contact or fall risk. Prioritize control over intensity. You're not giving up what you love. You're adapting it to protect what you love even more. Your body will communicate clearly if something is wrong. Stop exercising immediately if you experience vaginal bleeding or fluid leakage, dizziness or feeling faint, chest pain or heart palpitations, painful uterine contractions that don't stop with rest, decreased fetal movement, calf pain or swelling which could indicate a blood clot or sudden severe headache. These symptoms aren't common, but knowing them provides a safety framework. Also respect softer signals. Excessive fatigue that doesn't improve with rest, persistent nausea, unusual shortness of breath beyond normal pregnancy breathlessness. Trust your instincts completely. If something feels wrong, it's always appropriate to stop and consult your healthcare provider. It's better to be cautious and reassured than to push through genuine warning signs. You know your body better than anyone else. Listen to it. Here's what matters most. Staying active isn't just safe. It's beneficial for both you and your baby. Regular exercise reduces your risk of gestational diabetes by 27%. That's significant. It decreases excessive weight gain, lowers your chances of needing a cesarean delivery, reduces back pain and pregnancy discomfort, improves your mood and reduces anxiety, promotes better sleep, and leads to faster postpartum recovery. Research shows that babies of active mothers have healthier birth weights and improved cardiovascular health. You're not being selfish by exercising. You're giving your baby advantages that begin in the womb. Movement is medicine during pregnancy, and you have permission to prioritize it. You're not standing in that gym uncertain anymore. You know exactly what your body can handle right now. You know how to modify as you move through each trimester. You understand which warning signs require stopping and which adaptations keep you strong and safe. Exercise during pregnancy isn't about maintaining your pre-pregnancy body or proving anything. It's about honoring the incredible work your body's doing, preparing yourself for labor, and giving both you and your baby the benefits of staying active. You have the knowledge now. Trust it. Trust yourself. And keep moving in ways that feel good and keep you both healthy.